Well, good for you. And God bless you and others that are staying up finally against this, because people want this
Mhm.
information. I mean, a lot of folks are just like, hey, look, just tell me the truth and I'll figure it out. And when you
Right.
have misinformation campaigns and we're getting deplatformed for posting the
Yeah.
truth and just having conversation, I
Mhm.
mean, that's where this country works, is people come together and figuring it out. But when one
Yeah.
side is just hammering down on the other and not allowing the information to get out, that's when
Mhm.
the dominoes started to fall. So
Yeah.
when
Well, in early 21, not only was I taking care of COVID, like I took care of patients in the ICU through 4 COVID waves. And not only was I taking care of COVID patients, I was taking care of vaccine injured patients in the ICU. And nobody talks about that. But I had dementia patients that had exacerbation of their dementia that ended up with problems. I had people with, I had 5 ECMO patients at one time, and 4 of them were post jab. So crazy.
you know, and to go down that road, I'm seeing it in my own patients. I'm seeing stuff that I've never seen before. Younger people getting autoimmune disorders, and they just have all this crazy stuff going on that I've never
Mhm.
seen before. And the common denominator, as of right
Yeah.
now, is the pharma juice. I mean, that's the
Correct.
only thing. And so,
Yeah.
I mean, that's where I think people are very frustrated. And the medical professional I had on last week talked about, I mean, I think she said only 6% of people are taking that now. I
Oh
mean,
yeah.
so they
Everybody's onto this.
yeah, so I mean, it's slowly going to go to the wayside, I think, and they're going to quit pushing it because more and more people are getting turned off, especially with more and more
Yeah.
medical professionals just coming on these
Mhm.
platforms and talking common sense and say, "Hey, look, there's better ways to deal with this. Eat
Yeah.
healthy, exercise, don't be a fat ass." I mean, all these things that we already know. It's just common sense, little
Yeah.
logic thrown in there, and we'll get through this just fine.